Hello, my name is Caroline Teti, the Director Recipients Advocacy at Give Directly.
And I'm Han Sheng-Xie, Vice President for Innovation.
Today, we are going to share how COVID-19 has driven a huge transformation in how we deliver cash aid to hundreds of thousands around the world. But first, a little about Give Directly. Give Directly is the first and largest nonprofit that lets donors like you and I send money directly to the world's poorest. We believe people living in poverty deserve the dignity to choose for themselves how to best improve their lives, and cash enables that choice. We are also an evidence-driven organization with more than 15 randomized controlled trials, the gold standard of experimental research being done on our work. Just giving people cash has shown impacts ranging from reduction in hunger to improvements in education. And don't just take it from us. There are over 300 studies done on cash across the globe. People don't blow the money. Study after study has shown no increase in spending on things like alcohol and tobacco. And we see decreases in negative outcomes such as child labor. Finally, cash transfers are really good for the local economy. In a study in Western Kenya, we saw 2.6 multiple for every dollar transferred. While effective, the question that faced us at the start of the crisis was how to put more cash into people's wallets at an unprecedented speed and scale, and to do it safely during a pandemic. Cash is needed now more than ever. We've all seen in the news and images of COVID's impact. It's been devastating. In fact, up till last year, global poverty was on a steady decline. But the pandemic has broken this trend, causing the first global increase in poverty in 20 years. In fact, the World Bank estimates that more than 120 million people have been thrust into extreme poverty because of COVID. In response, at Give Directly, we've been delivering emergency cash across sub-Saharan Africa and the US, paying over 685,000 people impacted by the pandemic so far. While Give Directly has always made payments contactless via mobile money, which is basically like sending a digital payment, like just over an SMS instead of an app, traditionally, we've enrolled and verified people in need by going door to door and surveying households. But during a global pandemic, this approach poses a health risk to communities and staff, and the surveys can take months to reach thousands of people, time we didn't have as need mounted. If we were going to reach hundreds of thousands safely and quickly, we needed a new approach. Hans, over to you.
Thanks, Caroline. We had an idea. Data could help us remotely identify and verify the right people to pay. A few years earlier, we'd read research from a lab at the University of California, Berkeley, that showed how unconventional but ubiquitous data sources, like satellite and telecom data, could be used to remotely identify and verify the extreme poor at scale. The lab had shown that with satellite imagery, it's possible to rapidly focus in on areas of high poverty around the world. The intuition is this: wealthy and poor places often look different from above. Wealthy areas may have better roads, and homes may be made of more durable material, like brick and metal instead of mud and grass. The lab also showed that how one uses their cell phone can be highly predictive of poverty. Wealthy and poor individuals tend to use their phones differently. Wealthy individuals may spend more on data, while poor individuals may tend to not have smartphones and make fewer international calls. Because satellites and cell phones covered so much of the globe, we knew that if we could set up the right partnerships, offer aid remotely, and analyze and verify data securely, we could do three things: enroll, verify, and pay those in need at an unprecedented speed and scale. But to do this, we needed the right partners. Fortunately, we found great ones in the experts at UC Berkeley. We also found partners in a couple of telecommunications companies and Togo's government, who were looking for a new way to expand an existing cash program to reach the rural poor. The West African country of Togo is one of the poorest in the world, with a GDP per capita of just $680. Despite high levels of poverty, however, 90% of households have access to a phone. And so in partnership with academics, the Togo government, and telcos, we delivered 5 months of emergency cash aid to 100,000 of Togo's poorest individuals. It worked like this. First, we partnered with over 200 community leaders to explain the program to their communities. We then ran radio ads across thousands of square miles of rural Togo, encouraging people to dial star 855 and opt into the program through a quick survey that popped up on their screen. No smartphone needed. On the back end, the predictive technology verified the applicant's poverty levels and instantly paid anyone living under $1.25 a day via mobile money, which is basically, again, like sending a digital payment over text or SMS instead of using an app. The recipient can then pay for things with mobile money or pick it up from a mom and pop store in their village. Imagine that. You hear a radio ad about the program, you dial star 855, and you get paid instantly. No need to gather a file full of documents to prove your need or wait in line to petition for aid. Just instant payments during a lockdown. We enrolled, verified, and paid 100,000 people in weeks. Over to you, Caroline.
To have reached that scale without this digital approach would have required huge field teams, upwards of 3,000 individuals going door to door during a pandemic. It would simply have been infeasible. Moreover, preliminary research suggests that satellite and phone-based targeting were more accurate and inclusive than the next best option available. Unlike in the US, where tax returns are used to determine eligibility for COVID programs, Togo, like many developing countries, does not have such a universal registry. As such, the alternative approaches included paying everyone living in a specific geography, like rural areas, or everyone working in a specific industry, like the informal sector. Preliminary results suggest that our approach included 2.5 times more of the poorest individuals compared to the next best alternative method. We are incredibly excited about the scale of having paid 100,000 people in need through this approach. But I also want us to focus on what this means on the individual level. This is Eric, a 49-year-old farmer from southeastern Togo who sells peanuts, black-eyed peas, and cassavas for his living. When COVID hit, customers bought very little from him because of their own losses in income. In turn, Eric couldn't buy fertilizer to grow his crops or pay for his children's tuition. In October, after hearing about our program, Eric dialed star 855 to see if he qualified. And within minutes, he received his first $13 transfers, about half of his month's expenditure. With 4 of his children in school, Eric used his first 4 payments to pay for their tuition. In February, he used his 5th and final payment to buy fertilizer so he could keep his land productive. Hans, over to you.
Now, we've talked about the impact of this program on individuals in Togo and at scale across the whole country. But let's zoom even further out and look beyond Togo. The opportunities for such data-driven approaches are not limited to this pandemic. As climate crises become more frequent, similar technology could transform how aid is delivered after a natural disaster. In the US, we worked with Google.org to create a tool called Delphi, which integrates poverty data from the US Census and satellite images of natural disaster sites. By overlaying these 2 data sources, the tool identifies the hardest hit, poorest places where we should focus our work after a disaster. This slide shows Delphi mapping the city of Houston after Hurricane Harvey pummeled Texas in 2017. Orange dots represent damage to homes that were detected by AI analysis of satellite imagery, and pink blocks represent low-income neighborhoods. Overlaying the 2 helps us identify places of highest damage and poverty. Unfortunately, we did not have this tool during Hurricane Harvey, In fact, it was the hurricane that led us to develop this approach because many aid organizations, including GiveDirectly, missed a hard-hit community known as Port Arthur in favor of concentrating on Houston. While we were able to deliver cash to more than 1,500 households affected deeply by the disaster, it was also shown that 3 out of the 5 most impacted people were residents of Port Arthur. Better data helps us learn, and more data-driven decision-making can enable us to deliver aid to those who need it most. We're so glad that our last 3 years of investments in data-driven approaches have enabled us to deliver aid to so many of the world's poorest during this pandemic, who would otherwise have been left out. Back to you, Caroline.
But of course, our AI and data-driven approaches are not without challenges. As we continue to develop new ways to pay more people in need rapidly, here are some of our learnings and our North Stars. For one, it's imperative that communities have a voice in the decision-making around aid. In Togo, over 200 community leaders are engaged to provide input on program messaging, collect feedback, and help drive new iterations in program design. We also make outbound monitoring calls from our call center and provide a public hotline to hear directly from both beneficiaries and non-beneficiaries. And once it's safe, we'll conduct more extensive in-person surveys with researchers and with funding from Google.org and the World Bank. Second, satellite and phone-based targeting should be one of multiple ways into a safety net. When it's safe, there should be in-person approaches to applying for and receiving aid. And we have to recognize that every targeting and prediction approach carries risk of bias and exclusion error, even the most accurate ones. By making satellite and phone-based targeting just one piece of the broader puzzle, we further inclusivity without sacrificing speed and efficiency. And finally, we are designing AI-driven programs. It's important to have external oversight. GiveDirectly programs are overseen by governments, academics, and a panel of experts that include public policy specialists, ethicists, and community leaders. This diversity of viewpoints helps us drive new iterations to make our service better. As COVID continues to drive lockdown and impact the global south, we have a chance to not only meet the need of the current crisis, but to prepare us to better respond to the next major one. We need to put more cash in people's hands faster. But to do this well, we must couple groundbreaking technology with communities, greater inclusivity, and oversight. We should also share that our work relies on healthy and inclusive tech ecosystem. If you work in the payments and financial services, thank you for your work. Better financial connectivity drives global impact. But I also challenge all of us to find ways to work with mobile money, a product used by millions of the world's poor. Find ways to make it easier for low-income communities and for the less literate to use digital products. Whether you work in payments, the cloud, or AI, make your products accessible, tailored to the poor. Let's make the ecosystem an ecosystem that is available to the bottom billion, as robust as it is for the wealthy. By combining the sector's robust tech ecosystem with our model, we'll create a faster, more inclusive approach to responding to global needs, one that harnesses our collective desires to help the moment a crisis breaks on the front page. But ultimately, let's remember that good tech only gets us half the way there. People still need the cash. If we are committed to solving global inequities, I invite everyone to join and give generously. With good tech, we'll put your dollars in the hands of those who need it most. Your contribution matters. I hope you join us. Thank you.